Different methods for palpation of spleen. There are several methods for palpation of spleen. Preliminary preparations of the patient. During palpation of abdomen one must follow. 1. Always stand on the right side of the patient, as mostly we are right-handed. 2. Flex the thighs, to relax the abdominal musculature. 3. Turn the patient's face to the left, so that patient cannot breathe on your face. 4. Ask the patient to breathe deeply but regularly with open mouth, liver, spleen, gallbladder, and kidneys move with respiration. 5. Hands of the patient will lie by the side of his/her trunk, helps to relax the abdomen. The hands of the examiner should be made warm by rubbing together vigorously. The patient should be relaxed and reassured. A gentle and unhurried palpation with care of the painful sites gain confidence of the patient and helps in extraction of maximal informations. Exposure of abdomen from the xiphisternum to upper thigh, in males, or to just above the inguinal ligament, in females, is usually carried out in inspection of abdomen. Exposure of abdomen, for palpation, above the xiphisternum. Below, just above the inguinal ligament, do not embarrass the patient by exposing genitalia. Remember, the patient should lie flat comfortably on his back, on a firm mattress, with the head supported by a pillow. There should be good light, for the purpose of examination. In the winter season. Standing on the right side of the patient. Place the flat of the left palm firmly over the left costal margin posterolaterally and press it forward and medially, so as to enable a slightly enlarged soft spleen closer to the palpating right hand. Ask the patient to breathe in deeply and start palpating the spleen with the right hand. Starting from the right iliac fossa, move upwards and laterally towards the left hypochondrium, 1 centimeter at a time between each breath. If the spleen is not palpable, move the right hand more upwards with each inspiration until the fingertips reach under the left costal margin. Start well out to the left of costal margin and gradually move more medially. It is better to palpate the spleen with the fingertips, but few clinicians prefer to use the radial border of right index finger. If spleen is not palpable, or in a just palpable spleen, by the method mentioned above, turn the patient to right lateral decubitus position and palpate the spleen by hooked fingers of right hand placed under the left costal arch, or by the same palpatory method mentioned above, palm lying flat, beginning close to the left costal margin while the patient is breathing in and out deeply. Patient will flex his left hip and knee while in right lateral decubitus position. The examiner's left hand should remain over the lowermost rib cage posterolaterally on the left side as before. In case of a just palpable spleen, finally stand on the left side of the supine patient, facing the foot end of the bed. Palpate the spleen by hooked fingers of left hand below the left costal margin while the patient breathes in and out deeply, classical hooking method. Hooking method may be done from the left side in sitting position of the patient. If the spleen is not palpable by method I, go for method 2 and then for method 3. Phases of respiration are very important in palpation of spleen. While palpating spleen, do not be hasty and rash, rather show endurance. A just palpable spleen will definitely touch your fingers at the height of inspiration. Method I and 2 may be called as by manual palpation. Dipping method is always applied in the presence of ascites.